Everyone, welcome to our webinar on the impact of the COVID pandemic on our children's future. Thank you for joining us. I'm really pleased to be together with a distinguished panel of speakers who have experience in how our children are being impacted by this pandemic. I am the campaign chair for Love Beyond Borders, the interfaith movement to end the pandemic. I'm also the World Evangelical Alliance liaison to the World Health Organization. And in that role, I've been working with a number of organizations in terms of the faith community's response to the pandemic. We've been very concerned about how the pandemic is having a long-term impact on our most vulnerable populations, and particularly among those, our children. Our attention to the pandemic and to its impacts, as I'm sure everyone is aware, is now being challenged by a number of crises. The Ukraine crisis, of course, is everyone's concern, but there's also been recent cuts to COVAX support. There has been a growing pandemic fatigue, and there's just been a sense among a number of people that as the pandemic fades to the background, that we don't need to be so concerned about dealing with vaccination and its long-term impacts. So in this webinar, we're hoping to create a resource that calls attention to the need to continue to not only help the world be equitably vaccinated, but also to realize that beyond vaccination, we have work to do to help those who are suffering to be able to recover. So in this webinar, we're going to invite each of our panelists to say a word about what they are seeing are those impacts to children in their organizational and country context. We're recording this. We're going to make notes from this meeting. We're going to make it available broadly to our participants and to the public. After some initial statements, we're going to go into a discussion with our panelists. And I want to invite the audience to use the Q&A in the Zoom link to be able to post questions that you would have for our panel. So just a couple of housekeeping things. As I mentioned, this is being recorded, and we'll have the link probably in a week or so and make that available to all of the participants. We're also going to save links and references that are going to be posted in chat. We've invited our panelists to share links to their organization or other references that they may have, and we'll be saving that chat. I'm going to post a few links myself momentarily, giving you the link to the Interfaith movement. If you are part of the United Methodist Church, there's also a link to what is called the Advance, and some other links in terms of the campaign for Love Beyond Borders, where you can find some more resources. So with that, I am going to start off by introducing the first of our panelists. And I would like to introduce, as soon as I find my note here, Phil Green. Phil is the Global Partnerships lead for World Without Orphans, which is based in the UK. Interestingly, I saw that World Without Orphans got its start in the Ukraine, and I'm sure you're going to have a lot of work to do, unfortunately, in Ukraine. So with that, I'm pleased to hand off to Phil.
Thank you for your welcome, David, and thank you everyone for taking time to be at this webinar today addressing this really important topic. So in early 2020, as COVID was rapidly spreading around the world, one of the World Without Orphans ambassadors in Zambia, a guy named Remy, asked Susan Hillis, one of our advisors, a question. He said, "What about the grannies?" And he was referring to the grandmothers in his country, Zambia, who were caring for children who had been orphaned by the HIV/AIDS pandemic over the last few decades. And he was concerned because he recognized that these grannies were now particularly vulnerable from COVID. And if they were to die of COVID, what would happen to the children? And this kept Susan Hillis up at night as she pondered this question. But conveniently, she was also a senior scientist at the Centers for Disease Control with the US government, so was able to do something about it. But first, let me introduce you to the family you see on the screen. These 5 children had already lost their father. And then towards the beginning of the COVID pandemic, they also lost their mother, Sarah. She worked as a cleaner at the hospital, so probably picked up COVID from there. And they're now being cared for by their elderly grandmother. But what happens if she gets COVID and also dies? So Susan Hillis, as she couldn't sleep, thinking about how many children are going to be impacted by COVID in this way through losing a parent or grandparent caregiver, she called together a global group of experts. She brought together mathematical modelists and social scientists and practitioners from around the world to figure out how many children were losing a parent or a grandparent caregiver as a result of COVID. Because we recognize that losing a parent or caregiver is extremely significant on the lives of children, and it must be happening in the context of COVID, but no one was really talking about it as an issue. The first results were published in The Lancet in mid-2021, and they were deeply concerning. As of last week, the number stood at 7.2 million children globally have experienced the death of a parent or grandparent caregiver because of COVID-19. And these are minimum estimates. I'll post a link in the chat later where you can find out what the figures are for your country. And as you can see from the graph in front of you, at the moment, almost 5 million children have lost one or both parents as a result of COVID-19. And this number is significant because it took 10 years of HIV/AIDS for 5 million children to be impacted in this way. Yet with COVID, it's only taken 2 years for us to reach this grim milestone. And the loss of a parent or caregiver is significant for children, regardless of their age, and presents many risks. But we now know that 2 out of every children who loses a parent or grandparent caregiver is an adolescence. And this presents specific challenges. For example, it increases the risk of sexual violence, HIV/AIDS infection, suicide, child labour, and quitting school to care for younger siblings. And knowing the specific challenges is helpful because it can guide the necessary solutions. We also now know that 3 out of every 4 children will have lost their father rather than their mother. And this also presents specific challenges, with paternal deaths being linked to family economic hardships, decreased monitoring, guidance and boundary setting, and for girls, increased risk of sexual violence, teen pregnancy, and early marriage. Now, the motivation for this research was not simply to ensure that this specific problem of COVID-19 was on the agenda, but recognizing that there was a huge risk that the solution to this challenge, as many of the other challenges facing children within COVID, would be to build orphanages. And this is not the solution, because children reach their full potential in safe and loving families. And the good news is we know what works. Decades of action and research into the impact of HIV/AIDS has shown what we can do to make a difference. Therefore, we need to ensure that the solution is to strengthen family, not to build orphanages. First, we need to prevent the deaths in the first place, including the equitable distribution of vaccines. Secondly, we need to prepare family-based support and avoid institutionalization. And thirdly, we need to protect children from poverty, adversity, and violence. We know what works to support and strengthen families. And so that the children who have experienced such a great loss can go on to thrive. And churches, as we'll discuss later in this session, are well placed to make that happen. But returning to Sarah's 5 children, their grandmother is currently being supported by a local church. and with the support of one of WWO's partner organisations, Forgotten Voices International. She is being supported. And the evidence shows that if she receives parenting support, education support, and economic support, this will go a long way to ensure that this family can stay together and the children can thrive. It's now my pleasure to introduce our next speaker, who is Lana Williams-Adden, who has almost 2 decades of experience working in international development, with much experience in Sub-Saharan Africa, Southeast Asia, and Central America. And much of that work has focused on children. She is currently the Senior Vice President for International Programs at World Relief, and she will now speak to us.
Thank you very much, Phil. Good morning, good day, everybody. World Relief is a global Christian humanitarian organization that works with local churches and communities to reach more than 4 million of the world's most vulnerable people annually. We've worked for almost 80 years with communities that are already faced with a multitude of challenges. COVID-19 has exacerbated and magnified these challenges. Like many, we at World Relief are seeing the effects that COVID has had and will continue to have on children and their families, especially if we do not intervene. UNICEF recently said that COVID-19 is the biggest crisis for children in its 75-year history. It is reversing hard-won progress, and without action, the world faces a lost decade of children. So what makes this crisis so wide-reaching and potentially devastating? First, for the first time in almost 4 decades, we've seen a dramatic rise in the levels of extreme poverty. There's a jump in the number of people who will fall back into or join the ranks of those who live under $2 a day. We know that when household incomes are pinched, historically, women and children will bear the brunt of that effect. Fewer resources at the household level will mean less access to nutritious foods, less access to education, increases in interfamiliar violence, less access to needed healthcare services, etc. And we're already starting to see those effects on children. In 2021, UNICEF reported that we will see an additional 10 million child marriages in the next decade because partly for contracting household incomes and lack of access to education for girls. Emerging data and reports also show that all types of violence against women and girls, and particularly domestic violence, has intensified since the pandemic began. That's also due in part to conflict over control for limited household resources. Domestic violence helplines and shelters around the world began to report a spike in calls for help at the beginning of the pandemic, and we continue to see that spike rise. While the wide-scale interruption of key services that we saw at the beginning of the pandemic have largely ended, we continue to see that there are some negative effects that have happened for children that were impacted. For example, in Malawi, we had to close our early childhood development centers for a time when the government closed all of the schools. And at these centers, children are part of a feeding program and they're engaged in early learning and play. So when nutrition and formal learning opportunities during these crucial early development years are interrupted, we see that there is a decrease in the likelihood that children will reach their full potential later in life. So these paused services really have an outsized effect that we are now working to remedy. Pausing early childhood services also disproportionately impacts women who are now trying to balance caregiving, managing the household, economic contribution in the household, and this has in turn impacted their ability to be attentive and to be responsive to the care needs of their children and to the long-term development of those children. In late 2020, the World Bank estimated that a 7-month absence from school would increase the share of children that couldn't read or understand a simple sentence by 10 percentage points. Now, in many cases, we know that children were out of school for much longer than just 7 months. For example, in Uganda, some schools are just now starting to open up after almost 2 years of being shut. The World Bank estimates that because of the pandemic, an additional 7 million children will drop out of school. This will be because they can no longer afford to be in school, they no longer have parental support for pursuing an education, or they've otherwise been removed from school to be able to provide for their families. So I know all of this is pretty grim. I want to end on a positive note and say that throughout the pandemic at World Relief, we've really been encouraged by how adaptable our programs have been to withstand the constraints of COVID-19 and to provide support to vulnerable families. We've also been struck by how resilient our local church partners have been and continue to be to reach the most vulnerable. I look forward to talking a little bit more about some of the solutions that we've implemented and how we've engaged churches later on in this panel. I'll also put in the chat a link to a report that World Relief published at the 2-year anniversary of the COVID pandemic declaration that details the effects of COVID on the world's poor and some of the key action items that churches and communities can take. So thank you. I want to now introduce Dr. Rob Reno. He is the founder of Visionary Family Ministries that he leads with his wife. Rob, over to you.
Well, thanks to everyone for making this important conversation possible. Again, Rob Reno with Visionary Family Ministries. My wife, Amy, and I have been married for nearly 28 years, and we've been blessed with 7 children. And we now have a granddaughter who's currently in our daughter's womb. She and her husband are ready to welcome baby this summer. So I share that with you because this conversation about the next generation is very personal for us. I'm overwhelmed with the urgency of the situation, and even our first 2 presenters talking about the impact that COVID has had on kids. I'm sure my tone here will reflect that. I hope you don't hear preachy, but passion. And it is great to be on a panel where we can address many facets of what children and families are facing, you know, from different viewpoints, but also different areas of emphasis. And I want to focus in on the spiritual impacts, the spiritual issues that children around the world are facing. I'm going to focus my few minutes here on some action steps, how parents, how churches can intentionally provide spiritual care for children around the world. And I'm going to come at my portion, these action steps from a Christian perspective. Visionary Family Ministries is a Christian organization in response to some of these spiritual crises that we're seeing. So one of the urgent needs right now, I believe, is to call and equip parents to spiritually lead their children at home. I know we have panelists and attendees from all over the world, but in my country, in the States, during the past 50 years, there's been a terrible trend of parents delegating the spiritual training of their children to the church or perhaps a Christian school, that parents would drop their kids off at Sunday school or youth group in hopes that the experts, the spiritual professionals, would disciple their children. And biblically, that's upside down and backwards. Cover to cover in the Bible, God calls parents to be the primary spiritual trainers of their children in the home. And it's very personal for me. You know, the first 10 years of Amy's and my married life, we had 4 children during those years. I was a youth pastor. And as a youth pastor, I was focused on spiritually caring for other people's children, which was wonderful. But I was spiritually neglecting my children. I was praying with other people's children, not praying with my children. I was spiritually caring for other people's kids and not mine. And God had to do a real work in my own heart. And a scripture that changed my life on this was Deuteronomy chapter 6, which says, love the Lord your God with all your heart, with all your soul, and with all your strength. These commands that I give to you today are to be upon your hearts. And then God speaks to parents and he says, teach them diligently to your children and talk about God's word when you sit at home. That last phrase just convicted me so much and now has driven so much of our global ministry to parents around the world, that an essential task for church leaders, for community leaders, is to catch a vision for equipping parents and grandparents for this most important mission. And practically, that means teaching parents from a Christian perspective how to pray and read the Bible with their children at home. That family worship time, if we're concerned about the spiritual needs of kids, their family worship time is an essential meal for a child. And over in the chat afterwards, we've got some resources that are available for free from our ministry that you can use to help equip families for how to have this spiritual caregiving time with their children and their grandchildren at home. A second crisis response action item right now is to bring our churches back together. Our children need, from a Christian perspective, the body of Christ. They need their brothers and sisters in Christ. They need this spiritual meal every week of the worship and word of God in their faith community. You know, it's a regular conversation to talk about the terrible effects of social isolation that our children have experienced with COVID, but there's also been spiritual effects of isolation from their faith families. And this is especially true for those children and teenagers who don't have Christian homes. They don't have faith-filled homes. The church was their only spiritual meal. So one of the great victories, I believe, of the forces of evil in the universe these past 2 years is separating so many people from their local churches. Hebrews 12 tells us, do not give up meeting together, you know, as some are in the habit of doing. In my country, in the US, every church went online at the start of the pandemic, and online services are fine, but they can never substitute for meeting together as God tells us to do. So we didn't close the hospitals in response to COVID because there was an urgent medical crisis. And I don't think we should ever close our churches because of the spiritual crisis and ongoing spiritual needs. It's interesting, in the States, the demographic that has been the slowest to return to church are young families. You know, we might have expected that it would be the elderly or those with medical concerns, but it's been the young families. They simply fell out of the habit of gathering. Their sports, their activities now fill their Sunday schedules. So we are convinced and working with churches around the world that pastors, church leaders need to be lovingly, urgently calling and shepherding the flock back together again. And not only do our children need their church family to be physically together, but spiritually together as well. And we know that Satan's purpose is to steal, kill, and destroy. And part of how he does that is through division, dividing families, dividing churches. And they've used COVID to divide so many families and churches. And for the sake of our kids, we can't let that happen. There's a great burden on leaders and pastors right now to call for unity in the gospel, that a person's medical decisions as it relates to the vaccines for themselves, certainly for their children, you know, that those are personal decisions, that parents alone make those decisions for their kids, and that we as a family, we make this commitment. We as a family, we as a church family, we're not going to judge one another. We're going to respect differences of conviction and conscience. And we're just not going to follow the way of the world, which is division and judgment rather than love and welcome. I'm not trying to be preachy here. I see all these things trickle down and directly, practically affect the faith of our kids and their relationship with God and with his people. Third and finally, from a Christian perspective, I'm just so convinced more than ever, children need to hear the bold proclamation of the gospel from their parents and their churches. You open the news page, all the headlines are about sickness and death and fear and war and conflict and corruption. This is the air we're all breathing. This is the world our kids are growing up in. And kids need to know the cause of all these things. Why is the world falling apart? It's because of sin. And they need to know the solution. And that's the Savior, the Lord Jesus, who even came this Holy Week. We remember his death and resurrection from the dead and his promise to return. I'm burdened because the gospel is the anchor through this storm that our kids are going through. So thank you for allowing me to share from my heart. I'm grateful for this conversation today. Our next panelist, Dr. Les Dornan. He is a family physician, a missionary with the General Board of Global Ministries. He's a senior physician at the Tansen Hospital in Western Nepal in Asia, where they serve 100,000 patients a year. Les has a unique global perspective on children and families and the impact of COVID. And I know we're all looking forward to hearing from you, Dr. Dornan.
Thank you, Rob. It's a pleasure to be a part of this panel. And I'm mainly going to speak of my personal observations of the situation here in Nepal that we've experienced. And I think this is going to be something that's common in much of the less developed world as we continue our discussion here on the panel. The biggest thing that I've observed, and the thing I'm going to say first, because I think it has the biggest lasting impact, is that so many children have lost 2 years of schooling. The online schooling and remote learning is a good concept, but for those who lack the means to access it, it simply is not a substitute for school. There are many parts of Nepal that simply have no online or internet access at all. And many of the places that do, their only access is through their telephone. And many families don't have the devices to access these teaching opportunities. A good example is our chaplain at the hospital. He is salaried, and his wife is also salaried. She's an assistant in the dental department. So they're a relatively stable income and well-to-do family for Nepal. They have 2 telephones that are their only access to internet. And they have 5 children at home that were trying to do online classes, happening at different times with different teachers. It simply was not a system that they could get any reasonable amount of schooling out of. And I think this is typically repeated throughout the villages in Nepal and around the world, that children have lost 2 years of schooling. And because this is the main way that children in the less wealthy families are able to earn an income in the future and become productive citizens in the world, this is widening the gap for the rich and the poor now, and even more so for this generation as they grow and become the income earners of the future country and society that they're going to be in. The second thing I want to talk about is the neglected medical care that happened during the COVID pandemic. As a general medical surgical hospital here in Western Nepal, we've always emphasized treating the variety of problems that people have in the community and being available for emergency services. As the pandemic led to widespread lockdown and transportation difficulties, even people with medical issues either were not able to access transportation to the hospital, or they were afraid to come because they thought they would be infected while they were traveling or while they were at the hospital. So we had many people with commonly treatable conditions that would present later than they used to. We had appendicitis that were more likely to come after they were ruptured, people with obstructed labor that wouldn't come until it had been several days with no baby being delivered, and the various complications that come from these late presentations. There were people who had chronic medical conditions that they were neglecting to come for their treatment. And since we're focusing on children, the 2 examples I have are children with cerebral palsy who need ongoing therapy with the therapists in the hospital. And the family was afraid to come to the hospital for their therapy sessions. And these children will not be able to reach the same potential they would have been able to reach if they'd kept their regular appointment throughout the pandemic. People with epilepsy, the children with epilepsy were not able to get their medication refills. So many of them had recurrent seizures during this time. The third thing I want to talk about is the increase in poverty. In many countries in the world, people don't have salaried office jobs. The main 3 incomes that Nepal society has right now, one is migrant labor in other countries. And during the pandemic, the laborers from other countries generally were not able to continue working in the country where they were working at, were often sent to camps as they tried to relocate back to their home countries. And the families who depended on financial remittances from these migrant laborers were basically without income during this time. The second source of income for Nepal is tourism, with our wonderful natural beauty. But nobody wanted to travel during the pandemic. So all the tourism associated industry in Nepal was shut down for the last 2 years. And the third way that people earn income is daily wages. The majority of the people in Nepal are still subsistence farmers, but those who don't have land, their only income is a daily wage job, most of it in being construction workers or porters. And as the economy in general was slowed down, many of these families could not find daily wage work, and they were also left destitute. The last problem I want to talk about is the increase in mental illness that we've seen. And this comes, I think, from the isolation that people had during the lockdown, also from the discouraging news about the future and their fear of the contagion. Mental illness was very much up. Associated with that was the alcoholism and domestic violence that Lana also commented on. We have a great increase in the number of people coming having attempted suicide. And this is something that's continuing now, even after the lockdown has lessened much and most of the schools are back open. People are still struggling to catch up on their income, on education, on medical care. And I think this is leading to the continued discouragement and the mental illnesses that we're seeing. So that's a lot of bad news that we saw in the last 2 years. I think the main thing from my perspective that needs to be done for the future is to make sure we don't have to go through these strict lockdowns again, where there's no education and no employment and no financial income that the family can depend on. There needs to be continued transport. And we need to stop these pandemic restrictions by making sure that everybody gets vaccinated so we don't have to do these lockdowns again. So with that, I'd like to introduce our next speaker, Dr. Nico Soriano is a family doctor, but he is also a pastor. He is the program coordinator for family and church medicine in the Davao district of the United Methodist Church. And I'd be happy to introduce him to you now.
Thank you, Dr. Les. The ministry of the Health Board of the United Methodist Church in the Davao Episcopal area is focused among the less privileged and far-flung areas in the Philippines. And we focus on the most vulnerable population, especially the women, the youth, and the children. Among the youth, we focus on their risky behaviors like injection drug use and early sexual debut that puts them at risk for HIV infection. Also, our ministry is focused among pregnant women by helping them have access on health checkups and prenatal care, including HIV screening. And among our children's ministry, we help in the children's nutrition and disease prevention, including immunization. However, the pandemic has affected us and has put a great setback on the advances that we have gained on these health concerns. Almost 3.1 million cases of COVID has affected Filipinos, and 100,000 of them are on children. The pandemic have affected children greatly on many different levels, including their education, their mental health, and other secondary outcomes. We have great setback in our health targets. We need to recover those gains that we have from the previous years. For example, we have reduced malnutrition and stunting from 33% in 2016, reducing it to 30% in 2018, with a target that it will be reduced to 21% by 2022, this year. However, those gains of stunting by almost 2% every year have been put on setback with the pandemic. The stunting has now remained at 30% as of 2021. Now, 1 of every 3 child is small for their age. The same has happened with our HIV ministry. We have an increase of 54% of new cases as of 2021. And the sad part is only 60% of them have been able to receive treatment, far from our target of 90% of people living with HIV. The Philippines have been good with their vaccination targets. Currently, the Philippines is 3rd out of 10 ASEAN countries in ranking in COVID-19 vaccination, and we are 16 out of 205 countries in the world. But the target vaccination group still has not reached the herd immunity level that we have targeted. We target at 80% of the Philippine population, but currently we are at 73.47%. And the pediatric vaccination currently is very low. We see vaccine should be available for all, and it will greatly help us gain and achieve our health targets again. But vaccine is not readily available, especially in countries like here in Asia. But everybody of us are affected by this pandemic. However, there's inequity in the risk and impact of infection to the least, like the young children. The pandemic affects everyone, but it is very risky for those vulnerable population, especially the children. Not all children are affected in the same way. The rich and powerful can be affected, but they may be able to survive it. But we cannot say the same to women and children, because they may not be able to survive if they get infected by COVID-19. Plus, aside from the infection, other factors has also been affected, including increase in domestic violence, child abuse, increase for sexual abuse among children and girls, mothers leaving their children, children being orphaned because their parents have died, their education has been disrupted, learning is disrupted, our health system has been affected, making vaccines inaccessible, making healthcare inaccessible. So these things have affected, the pandemic has affected all these things. Now, as a church, we could do something. Although everyone is affected by this pandemic, everyone should also contribute, including the church. And the church can play a big role if we act as one. The church, we know, is the body of Christ. And when Jesus came, he said, he came to give life, to give an abundant life. And as a church, we should care for each other. And caring is loving. And at this time of the pandemic, we must take care of each other. We must be able to care for each other's health and the need of each other as works of our mercy and our acts of compassion, because we are our brothers and sisters' keeper. And so the church must therefore respond as one body of Christ to the needs of each other. At this point, I am honored to introduce a very admirable man of God who has long years of experience working with churches in South Africa by supporting these churches to become transformative agents in our communities. The Senior Advisor for Church Partnership for World Vision International, Craig Stewart.
Thank you so much. It's a real privilege to join this panel and to be listening to all of these stories, albeit them daunting. World Vision International is a global organization inspired and enabled by a Christian faith to work alongside communities in around 100 countries around the world. Over the last few years, we're impacting 75 million people in our focus of helping the most vulnerable children in this world overcome poverty and experience the fullness of life that's just been spoken of. I'm sure for all of us on this call, and certainly for myself, COVID has felt like an apocalypse. And in the face of these 2 years, World Vision has been working hard to address the impact of COVID itself in supporting vaccine rollouts, equity in vaccines, and in demand creation programming, and particularly including faith-related concerns about vaccines around the world. Biblically, though, apocalypses are not simply a dramatic ending or a destructive ending. Apocalypses in a biblical sense are unveiling. That's why the New Testament book in the Christian scriptures, the apocalyptic book, is a revelation. And that has been true for COVID as an apocalypse. COVID has revealed and made visible the inequities and vulnerabilities that children are facing around the world. And for the most part has made those worse or seen them regress backwards, as we've seen by multiple of our panelists today. For many of the communities and children where we are present, these follow-on impacts of COVID, the impact on the health system, hunger and food insecurity, economic problems, children falling behind in education, increased mental health and psychosocial support needs, and then dramatic increases in families facing poverty, as has been noted by all of our panelists, which ultimately contribute to a range of behaviors that threaten children. An example being child marriages, children labor, increased violence. All of these are of significant concern to the communities in which we work, and they will continue to be a growing concern if we don't address the ongoing impact of COVID, and in particular address vaccine rollout in such a way that we can prevent these other secondary issues from growing and being more exacerbated. Some of the examples of these impacts statistically are that UNICEF recently reported that 23 million children under the age of 1 have missed out on their basic childhood vaccines in 2020. And then this puts them at risk from devastating preventable diseases like measles, polio, and meningitis, not only now, but into the future. By the end of this year, over 60 million children under the age of 5 will be suffering from wasting or acute malnutrition. And this is an increase of 13.6 million since 2019 and is largely a consequence of these COVID-related impacts. And wasting, as has previously been mentioned, has substantial long-term developmental consequences for vulnerable children, having impact on their social lives, their education, and their well-being in general. Similarly, while most of the world's children, including many of our own, were out of school during COVID-19, as Les has noted, those who are the most vulnerable, refugees and children living in fragile contexts, have been far more affected by education. In 6 conflict-affected countries, a World Vision survey in 2020-2021 showed that over 90% of children in those countries were unable to access school over the past 2 years. And as has been previously mentioned by a panelist, that has consequences long beyond those 2 years. But what has also been true is that in that time, in our work in the field and in our concern for vulnerable children, we've seen significant activity from church leaders and faith leaders around the world in those places. Church leaders have played a particular role in providing good information and in changing minds within communities. Globally, we've worked with almost 200,000 faith leaders on this work. And one example is a local bishop in the country of Lesotho who was opposed to vaccines. And after participating in what we call a Channels of Hope program, he changed his mind and became a champion for vaccines, and he started using his church site as a vaccine site and promoting vaccination amongst his community. One of the strengths of church leaders and faith leaders is that we are proximate, we're alongside the issues that we've named today, these things that are unveiled by this apocalypse of COVID. These issues are adjacent to and in the communities where faith leaders are. They have been there and will continue to be there across the world. And so they're able both to provide information on who the most vulnerable children are in communities, and they're able to ensure that responses can happen when other systems are overwhelmed. In Brazil, There's a story of one pastor that World Vision works with who traveled up and down the Amazon on his own, ensuring the provision of 15,000 food kits across the region to the most vulnerable children. And in communities across the world, we see these actions repeated by faith leaders, addressing both the direct and the indirect impact of COVID, from back to school campaigns in Somalia to trauma interventions by pastors in Congo. We've all been involved in these things. At World Vision, we have a commitment to the world's most vulnerable children. And churches and local congregations and big denominations have done incredible things in these last few years, bearing witness to the good news of Jesus in these neighborhoods and the communities where they live. But the longer we take to address vaccine inequity, the longer we take to ensure significant vaccine rollout, the longer these direct and indirect impacts will be felt, particularly by the most vulnerable children in this world. And they will set our collective work back a long way. The great apocalyptic book of the Christian faith, the book of Revelation, and talks in great terms about this unveiling of dragons and beasts and terrible things. But there's also the story that it unveils the Lamb, bringing good news to the poor. And as we consider our position going forward as local church communities, as local faith leaders, in the face of that which is COVID is unveiling, we can also lean towards the unveiling of the work that we are called to do as the people who proclaim this good news to the most vulnerable people in the world. And so I also now get to hand on to my colleague and fellow panelist, Imad Aoun. He is an advocacy and communications specialist with UNICEF with a particular focus on COVID-19 vaccines. He's originally from Lebanon, but is now based in NYC, New York City, working with UNICEF. He's got significant experience in apocalypses and that he's worked in a multiplicity of humanitarian crises. And I'm looking forward to hearing from him on his experience and input for us today. Thanks, Imad.
Thanks so much, Greg, for the introduction. Hello, everyone. As Greg mentioned, I'm working with UNICEF. I haven't been with UNICEF for a very long time, but I'm working now on COVID vaccines and advocacy and communication. So a lot of what I do is really about engaging with different stakeholders outside the organization, outside UNICEF, to try to make sure that they have information they need, they have, that we can together somehow make a positive change towards children. So UNICEF is the UN Children's Agency. We work in more than 190 countries around the world and territories. Our focus is very much about saving children's lives, defending their rights, and then, of course, making sure that they can fulfill their potential. Based on that and based on the work that we've been doing and we continue to do around the world, I really wanted to focus on two specific areas where children have been impacted. And I think, unfortunately, coming towards later in the panel, a lot of this has already been mentioned, but I'll try to summarize it. And there are a couple of areas where I'd like to add bits of information. So the two areas for me, or for UNICEF in general, are really routine immunization. So the impact of COVID-19 on children's vaccinations beyond COVID vaccines. So measles, mumps, rubella, diphtheria, and discussing a bit how COVID vaccines and all the energy and resources focused on dealing with the pandemic has taken away a lot of attention and money and human resources away from other services like routine immunization. Craig mentioned the statistic, and I'll put it later in the chat. In 2020, for the first time in 10 years, we saw an increase in the number of children that had not received any of the classic childhood vaccinations. And this was a bit of a dramatic thing for us, because since 2009, we've kind of seen that number stabilize or decrease. So we were able to vaccinate more and more children steadily around the world since 2009. But because of the pandemic and in 2020, for the first time, that number jumped dramatically. We also saw an increase in the number of children who have not received any vaccine at all. So that was also a bit of a dramatic piece of information, that we're starting to see an increase in children who have lost access to vaccines. And these are things that UNICEF and other organizations have spent a lot of years trying to build these connections, trying to make sure that people in remote areas can take their children to get vaccinated. So there's a lot of work that has been offset or has been undermined by the pandemic. And today we have the data, but I think the actual impact of this is yet to be seen, and it's going to take a while before we can actually capture what this means. There is a concern that with less and less children getting their routine vaccinations, of course, this can impact their development, but it can also cause outbreaks of disease that we thought or that are believed to have been under control, but because of the decrease in vaccination, it could provoke new outbreaks. That's one area. The other area is education. And I know that some of the co-panelists have mentioned this already, but children out of schools is another area that we have been very concerned about, and we have been really advocating incessantly around the world in different countries with ministries of health, civil society groups. We've really been trying to rally more and more support to bring children back to in-person teaching in schools. The reason for this, again, I mean, I'm trying to avoid repeating what has been said. One of the key things is that we have been arguing that children have not necessarily been the main drivers of the pandemic. There's no context where children were the main group that has been increasing or causing an increase in community infection. In fact, they more react to the reality outside. So schools as well have not been places where infections have been happening at a higher level than around them in the community. So in a sense, both schools and children have not been the main causes of the spread of the virus in any community around the world. So that has always been kind of our argument to say there are safe ways and there are things we can do simply that are simple and accessible, and we all know them, which is basically wearing masks, keeping a safe distance. Within these measures, we can safely reopen schools. We can safely have children go back to schools, have in-person teaching, be able to interact with each other. We know that this impacts their mental health, their developmental processes. So it's a bit important, and it's at this point quite urgent, because we know that in some countries it's been a year and a half or 2 years that children haven't been physically back to school. So it's becoming a bit of an urgent crisis, and we're shifting a bit from a crisis of COVID to a crisis of education, having a lost generation. And it's a bit alarming, and we continue to work on this. The other thing I wanted to link to with this discussion and trying to understand a bit how we can help children, how the church can help children around the world, we have to, in our understanding of what's happening, I think it's important to contextualize a bit the issue of vaccines. Vaccines are a very important first step in our recovery against the pandemic, but they're not the only step. They're not the only thing that we need to do. I think the way the pandemic is being described today, there's a lot more focus on vaccines than vaccines warrant. It's one step of a much longer journey. Today, we talk a lot more about a toolkit of things, of which vaccine is one item. So we talk about masks, we talk about tests, we talk about oxygen ventilators. So there's a lot of things that need to be taken into consideration when we discuss how we're going to address this pandemic or reverse a bit the negative things that we've seen. In some countries, vaccine coverage is quite high, but transmission continues. So in that context, we need to then make sure that people have masks and people have the information they need on when to use the masks. So vaccines are not going to be the answer to all of our questions on the pandemic. The other thing to keep in mind as well, that in low-income countries, they may have vaccines, but they may not have syringes. They may not have cold chain storage. They may not have nurses and doctors, enough nurses and doctors who are trained to administer these vaccines. Because remember, the pandemic is a huge undertaking that's requiring a lot of resources to run vaccination campaigns that are at a large scale. So a lot of countries don't have the resources they need to do that. So in a sense, we need to think of it as an entire health system approach, that vaccines are just one element, but we need to make sure we have all these different things coming together to support any country or any government that's trying to address this pandemic. One last point that I wanted to make, as part of this health system approach, or as part of this more comprehensive approach to combating the virus, we need to also prioritize information. And that's a bit where I think the church, religious leaders can really help us a lot. We live in a situation today, and I'm sure you're all aware of this, where there is an overload of information, whether it's on social media, which translates into day-to-day word-of-mouth information circulating about what's good, what's bad, should I do this, should I do that? Are vaccines efficient, are they not? Is this brand more efficient than the other? There's a bit of an overload of information, and people at times have a lot of questions that are not answered. They have a lot of questions about their personal situations. And I think it's important that we seek the support of the church, the religious leaders in these communities, because in many cases, they're the ones that are trusted by a lot of people. They're the ones that people go to with concerns that they might have about their health, their body, their family. that might not be addressed by others, or that might be addressed on the internet, but you never know what you're reading on the internet. So there is that element where I think the church can play a really important role in trying to be this conduit or this focal point in communities where people can find someone that they're able to discuss with their concerns. The church can play a role of linking these people with different organizations or agencies, whether it's UNICEF or others, it doesn't matter. But I think that's a bit where we also, as agencies, as health organizations, we also rely on religious leaders, on religious figures, to also help us understand a bit what the dynamics are in these communities. What are people most concerned about? What are the questions that people are raising? Because that also helps us as an organization target a bit our messaging. If we know in some area there's a high rate of people who have questions about one particular vaccine, one particular brand, maybe pregnant women have a specific question about, many pregnant women may have specific questions about certain things related to their babies, we know a bit how to tailor our approach. So in a sense, I really would like to emphasize this idea that the church, religious leaders, religious figures can really play this role of a link between communities and the global community, or the bigger entities like agencies like the UN, UNICEF, and others as well. They can play this role that links between these different groups, at least to be able to provide information back and forth. And with that, I have the honor of introducing my co-panelist, Dr. Glenn Paroso, who's joining us from the Philippines, I believe. So Dr. Glenn, over to you.
Thank you. I'm starting to share screen. Hold on. Nina, can you just share the screen? Oh, right. So just to start off, Mary Johnson Hospital has been with us since 1906, and I just want to say that that's been quite some time, and I've been in Mary Johnson Hospital in 2016 as its executive director. We are in the Manila part of the Philippines, while Dr. Neki is on the southern part of the Philippines, and we are in a very depressed area called Tondo, where a lot of the cases really were for COVID-19 really had an impact in the Manila area. Next slide, please. Right. So just for the questions which are looking at us and staring at us, we can see that from the long-term consequences, there's like three things that we are looking at, right? They are of the direct consequences of the disease, and we're looking at the numbers of people and children who get sick or are dead. And then there's the long term, which is a multi-system inflammatory syndrome in children. This is an allergic syndrome which has not yet been explained how it happens, but it usually happens apart from afterwards having COVID. And of course, the other or short to long term effect is mental health. And we know that because of as other speakers have mentioned earlier, when you lose a parent, you lose a brother or sister, or you lose a sibling, it's really very hard to cope with all of this in the mental health aspect of things. And there also is, as others were saying, there's an interruption of essential services. In the Philippines, I think we're the longest that have been in lockdown, and a lot of our education is just starting right now. And a lot of them is online, as our doctor from Nepal was saying. It's really hard to have online education. In the Philippines, we don't have internet in all of the places. They're at varying speeds, and even the teachers are having a hard time because it's the first time that we're going online. So it's both hard for the student and the teacher if we have this education. And a lot of our preschool and kindergarten have not moved on because of the last 2 years. It also is affecting our nutrition and child labor because of parents not either dying or not having jobs. The children have to work in order to fend for themselves. And with the increasing poverty that's brought about by COVID-19, there really is a lot of inequity that's going on, and children are the most vulnerable, as we can see also in our hospital, as we see the children who are being brought there by parents or even their uncles, not anymore the parents, because the parents have died. In the Philippines, you have 1.2 million children aged 5 to 11. This is as of March of 15, 2022, and 9.7 million minors who are vaccinated. So that's 36% of 30 million. So that's a very low number for us, as Doc Neki was saying. Next slide, please. So you can see that the short-term and long-term consequences have really impacted us here. We can do, these things that can help parents and families with the impacts. It was shared also earlier, like you could have family counseling sessions. We have a program of clinical pastoral education, wherein we have a pastor that goes around with our COVID patients and are helping them look at how they can overcome this long-term and short-term effects. And counseling is really for all of the families, especially those that lose, when you have COVID, like the child, it's very traumatic. You cannot go near the child because they're in isolation. And what happens is that the mother really is just, we have to let them sign waivers because they have to be with their children. And sometimes, it's either way that they get infected. Next, please. Looking at setting up a network of NGOs to establish a COVID support fund would also be one of those things that we can help up with this initiative. We can come up with the different needs that these families and these children will be having in the long term and in the short term. Next, please. This is very important because we noticed this, that there has to be a pool of physicians that can be referred to, especially in the hospital and other hospitals for that matter, and also in the community. If we have pediatricians, psychologists, and family physicians working together, and this could help parents and the families with those children that are impacted with the COVID-19. Next, please. And this can be done either with a private-public partnership, so that both government, the local government units, and private hospitals or health facilities can come together in setting this up. Next, please. And it's also very important if we can gather and document cases. This will be very good for us because the practices that are there can be done in the same places and scale them up. Next slide. The church is very important because it will play a very important role in making things happen. It's in the most strategic place that the church can respond. Next, please. If there are local solutions and get the community and the church participation to come together, that would be best. In Tondo, there are several churches around the Mary Johnson Hospital, and we saw that it didn't really matter if we were Catholic or Protestant, and they were working together. They were giving food, they were helping each other, and they were talking to the families, and it was very important for them to do this. And we saw that this was a very important aspect of coming together, involving the community and the churches. And let's look at strengthening initiatives to deal with issues of mortality and coping and recovery, because with COVID in children, you are isolated and you die alone. This also goes for adolescents, right? So if we have this priests and this pastors who are going around and having to deal with these issues. It's going to be very helpful. Church schools, we saw that in the Philippines, a lot of the churches have schools. And if we can help them out with the online requirements, then it will also help out as the role of the local church. Next, please. There should be a church to hospital referral system, especially for MISC or the multi-system inflammatory syndrome, because not all of the hospitals are at the tertiary level that this can be treated, and a very good referral system would be in place to help out. And if there's a connection with the church, then that would be very good. Next slide, please. Just to show you, I'm going to close in a while. In Mary Johnson Hospital, we've had this. You can see that from 0 to 5, these are our statistics at the Department of Pediatrics. We had a total of 26, I should say, if I'm not mistaken. But that next slide, please. You can see that, yeah, that's the total. So you can see that it is mostly in the 0 to 5 that are affected of our children, but these are just the ones that were admitted in the hospital. Our statistics show that it is 4 times, because the other 75% of this did not want to be, they were seen at the emergency room, that they didn't want to be admitted in the hospital. So you can see, while we're a small hospital, 120 bed capacity, there are other hospitals around us, but we became also a catchment of all of these COVID cases in children. And we had the most of them in 2021, where the pandemic has hit us at the most. Yeah, I think this is going to be my last slide. And yeah, it's very important that we get together and do some actions in order that we can give solutions to this COVID pandemic, even as it moves forward, especially for the most vulnerable, which are our children. Thank you.
Thank you, Dr. Pereso. Now, I want to just very briefly say a word about the overarching theme that you're hearing from our panelists, and then I'm going to invite our panelists to talk about specific action steps that the faith community and churches can take. I think you're hearing 3 themes from our panelists. The first is that the great impact of the pandemic is not only medical, but it can be described as a loss of resource. People in general, children in particular, have lost a great variety of resources. They've lost emotional resources, family resources, economic, spiritual, and more. And it's these loss of resources that have the long-term consequence. Secondly, implied by some of our panelists, these losses tend to cascade over time. That is, once a person suffers a significant loss, they are set up to suffer more losses. And these losses can continue for an extensive period of time. In the case of our children, these losses can cascade over a lifetime. Without intervention, our children are set up to suffer from this pandemic for much of their lives. And then thirdly, you're also hearing that the response to this involves, in some cases, a specific clinical intervention, but more often a community responding to restore the children, to restore those losses, to reestablish those families, to reestablish access to resources, to reestablish their connection to their faith community. And so with that in mind, I'm going to ask Phil to kick off our discussion and invite our panelists to share with us, given the things we have just described, what then can we do? Phil, and then Lanry also was going to help us start off.
Thank you, David, and it's been great to listen to the other panelists. I want to begin by saying that if you are here today and you're a church leader, I want to say thank you and well done for all you have been doing during the pandemic. I imagine you may well be feeling overwhelmed having heard so much need. And it's really obvious that the church could be a really key part of the solution. But within that, you can feel what can I do? Because I'm already flat out, I'm already overextended, I'm already busy, and now you're asking us to do even more. So I want to first and foremost say well done and thank you for what you're already doing. I have the pleasure of working with a lot of government entities and international NGOs around the world, and during COVID-19 it was a real opportunity for the church to shine. And we've heard it said in so many different ways, but while our church buildings were closed, the church has never been more open in the way that it was able to engage and serve the community. And that has been noticed. And it's been a real opportunity for the church to demonstrate good news. So a UN publication from the UN Women published a report a few years ago that acknowledged the important role that faith communities have, and they defined it in 3 types of capital: access capital, social capital, and spiritual capital. And as faith leaders, you have access to communities, you have access to families, you're able to identify families that are in need. Secondly, you have social capital, which means you have influence. What you say really matters. And we've already heard that today in light of vaccination hesitancy. What church leaders say about vaccinations can make a real difference. And also you have infrastructures to deliver programs, not just in the short term, but in the long term as well. And you also have spiritual capital. The Bible gives us a huge wealth of hope and input on how to respond to situation. And also there's religious occasions that are really significant. So as church leaders, it's often you who are going to be doing end of rite rituals with people or burial rituals. It gives you the opportunity to ask families, what are the needs in the context I was sharing in terms of children who have lost a parent or caregiver. You could ask the question, what is going to happen to the children that are being left behind? You can help identify those children. And it's not always about what you can do, but it can also be about acting as a bridge, that you can identify the services that are available for people so that you're pointing people in the right direction. I'm going to finish with an example from our partners in India, where children who have lost one or both parents as a result of COVID can be at risk of being trafficked. So it was this faith-based organization that made sure that children who had lost a parent and were vulnerable were being appropriately assessed by the authorities about what support needs were needed in terms of foster care or possible adoption, recognizing that there are a lot of illegal adoption outfits kind of springing up in COVID hotspots. So it wasn't about the church per se doing anything different, but it was about them signposting and ensuring that families were able to access the services that they need.
Thanks, Phil. I'll just add a few comments. I wholly endorse all that Phil has shared there. I think that it's important, like Phil has said, to just highlight the role that church and other faith leaders have had and continue to have and continue to deliver services and identify vulnerable populations. I think in terms of what can churches do, continued advocacy for vaccine equity and for access and accurate information about vaccines, I think is going to be critically important. We know that access to the COVID vaccine is a key measure for prevention and for protection for vulnerable populations. I think also looking at addressing some of the economic impacts of the pandemic. At World Relief, we work in partnership with faith actors. We put together networks of churches, and World Relief provides technical assistance to deliver different kinds of programming. Some of the programming that we deliver specifically for economic impacts of the pandemic includes savings groups, financial literacy, in some cases cash transfers, but being able to rebuild a household's economic assets and livelihood is going to be key because of the ramifications and the linkages between household economics and all of the other impacts that we've talked about today. I think also looking at parenting support as well as couple strengthening support and support for children in kids clubs and other places where we can start to address some of the mental health, some of the interfamilial networks and conflicts that have arisen because of social isolation and the impacts of COVID on household incomes, being able to target how to strengthen families, how to strengthen couples, how to improve communication between children and their caregivers, how to equip caregivers in a whole family, whole community kind of approach is going to be really important. I think also just thinking through how to specifically support child protection committees that already exist in the target communities that we're working in. For us, that means at World Relief working with child protection committees that are already formed, partly with volunteers as well as local government entities, so that we can prevent and address child marriage, as well as addressing instances of violence that may be occurring to harm children. So I'll leave those there. And just to say that churches and church networks really have a powerful voice in being able to model and value the voices of children and to create safe congregations and safe spaces where children can express the effects of the past couple of years and find resources and support to mitigate those. I'll turn it over to the rest of the panel.
Yeah, thank you, Lanre. So for our last 10 minutes, let me throw it open to the panel and just invite people, other thoughts, either comments on other speakers or other suggestions you may have for our participants.
Yes, David, I would like to share some of the practical activities and actions that churches were able to do in response to this pandemic. One of the things that we have been doing, if I could share just some pictures, we conduct webinars, even if we cannot do face-to-face seminars. We do webinars. We do webinars with churches and communities in partnership with the local government and with the villages, so that we can promote vaccination. One of the concerns is that some religious organizations or communities are a little hesitant about vaccination and with the pandemic. And that's one of the practical actions that we've been trying to address. And the church can support vaccination through vaccine awareness webinars. Another that the churches are doing, like what Lanre mentioned, is about these community pantries that local churches provide, especially for those low resource areas. Because of poverty, they cannot access food, they lost their job, they don't have money to buy food. So churches are able to provide some food so that these families can get by at least for few days while they're looking for other resources. And the third probably is supporting areas with low vaccine. Just for example, here in Southern Philippines, we are far from the urban areas, and the children here are the last ones to receive the vaccines. So the vaccine rollout for children has started as early as February, but the vaccine was only able to arrive in the provinces in around late March or this early April, because of the lack of vaccines and the lack of health system resource that is able to provide the system so that the vaccines can be delivered in those far-flung areas. So those are some of the things that local churches can do, practical activities and actions, so that we can all address this pandemic.
David,
And also,
can I just tie in with Neki, since we're in the same neck of the woods? In Manila also, that's true, because also in Manila, the community pantries were a hit. You know, it's like it was a community approach to helping each other out. We call it in the Philippines, bayanihan. You know, we were helping each other even if we didn't know. The people would just line up and get whatever vegetables and eggs that they needed. And these were given by the different churches and other groups. That was a very good social capital that was running there. Second is that not only were the webinars for the churches, but we also gave in Manila, we gave webinars to the pastors and the families, because a lot of the pastors were also not convinced of the vaccines themselves. So we had to get them to be the ones to move this forward. And that was very fruitful because a lot of them changed their minds after we had several webinars with the pastors. So that again was a very good support group and a support action for moving the vaccine forward. The third was to look at how governments and churches can come together. You know, in a pandemic, everybody comes together. And this was a very opportune time for the churches and the government to be talking to each other. They don't usually talk to each other, but the COVID situation brought them together. And because it was in the spirit of sharing and the faith approach to giving solutions, and it's not just medicines, but the support. Thank you.
That's great. And Rob, you had a comment, and then I think Craig.
Yeah, very briefly, just a couple more concrete things that I think church leaders can do. And I love that phrase, that special capital or special access, right, that church leaders have to their communities. One is to try to identify a small group of families in your church who perhaps are in a stronger place spiritually, relationally, economically, who could be lighthouse families through the ministry of hospitality. See, we tend to, certainly in my country, we tend to think of the church building as the centerpiece for ministry. But if we can help those 1, 2, 3, 10, depending on the size of your church, stronger families, say, would you consider using your home as a place of ministry to your sphere of influence? Would you consider having your home be a lighthouse for our church? And then a second piece, we've talked so much about so many of these children that have lost parents or caregivers through COVID. That's where the church family has to play an even greater role in becoming literally a family for those children. But that's not going to happen unless we are more intentional about creating multi-generational connections in the church. Sometimes people come into churches and everybody gets split up by age. And so kids never have a chance to get to know other adults in the church. Teenagers never have a chance to get to know other adults in the church. So I'm convinced that one of the things we need to do is to press much more intentionally about creating multi-generational discipleship and relationship building opportunities in the church.
Thanks, Rob. Can I just go ahead, David? I think as we think about being a church leader in a community, perhaps three ways in which hopefully enriching what others have said is, one is I would encourage church leaders to be doing the work in your neighborhood, city, and region. I think some of us, and I'm aware that people listening are from across the world, but some of us might feel all of the problems over there. The reality is that one of the things COVID has done, I think, is made visible and created situations for vulnerable children in all of our neighborhoods. And so one of the ways I think we must do is, as we think about being the church, who are the vulnerable children, the vulnerable families in our neighborhoods, and how do we do that? And a practical way, if you're not already doing that, would be to map and come alongside agencies and support groups that are already involved and have been involved for a period of time with those children, and see if there are ways in which you can partner with them in practical ways as a local church community. I think secondly, from a global perspective, to be looking to find ways of supporting and coming alongside agencies that are doing the work globally that support local faith communities in this work, many of which are represented on this call. That I think they're great places to go and look and say, how do we invest in that? And I think a critical part of that would be to be asking the question, because faith leaders need early investment. We can't arrive in the midst of a crisis and say, let's make a difference. There needs ongoing work so that when something happens, there's already social capital, there's already work being done. And so in making the choice, who are you going to support, be thinking about how are people involved in the long work rather than how are people just doing things that can maybe make a change tomorrow. And then lastly, to be involved in advocacy and system change. We're talking about vaccine equity as one. There's food systems change and the way food distribution happens. And as faith leaders around the world, to be engaging in advocacy in your local community about the way in which the systems are impacting vulnerable children elsewhere in the world and in your neighborhood. And one practical example might be there to gather a group of faith leaders, to gather a group of church leaders in your city, in your region, to inform yourself about something like vaccine equity, and then to call your local political representatives to get involved in some of these campaigns so that we're also addressing system change and not just pushing things away from where we are. Hopefully that's helpful to people.
Thank you, Craig. We have a moment for the last word. Les, did you want to share a comment?
I would actually like to ask Rob if you want to address the impact that this COVID has on self-respect for the income earners in the family, that they've been forced to become more dependent, whether it's government or church programs.
Les, I'm sorry, I had a little hard time hearing your question there. Could you try again?
Sorry. I was wondering if you would address the impact the pandemic changes have had on the income earners for families who may have become forced to be dependent on churches or on government programs.
Talking about the spiritual impact of that?
Yes.
Overall, yeah. Well, it's a great question. It's probably one that we could spend a lot of time talking about. If you ask me about the impact of a family becoming dependent upon their church, I say thank you to the Lord for creating the safety net of the church. That's part of why God created it. You know, the New Testament makes this incredible statement about the church in Jerusalem. It said there were no poor among them, which it now doesn't mean everybody was wealthy, but it meant that the church provided this safety net of volunteer charity. Now, forgive me, I don't mean to upset things here. If you ask me about a family becoming dependent upon the government for their care and for their finances, you would get a very different response from me. I think that is destructive in the long term. There may be short-term help that can be valuable, but in the long term, I think that's economically destructive as well as spiritually destructive. And so I think our churches have a critical role to step into this need. And I'll say in the United States, I think it's one of the weakest areas of the church in the States, providing necessary benevolence care for the members of the church.
And with that, I want to say thank you to all the panelists. This has really been a great conversation. I really appreciate all of you taking the time from your very busy schedules and to be willing to be online together and discuss this important topic. Just a reminder for our audience, we have a recording that we're going to make available, and we'll also have some written notes. And panelists, I'll circulate those notes to you, so you'll have an opportunity to correct or expand on those as you see fit. And hopefully this will be a continuing resource available to faith leaders. So again, thank you to everyone for joining us, and panelists, thank you.